new study out suggesting that what you eat can lower your chances of developing dementia or Alzheimer's disease.
It makes sense. Food is medicine. New research in the medical journal BMC Medicine shows eating a Mediterranean diet consistently reduces your risk by nearly a quarter for dementia. And as the U.S. population ages, dementia is becoming a bigger issue. That's because the prevalence of it increases with age.
That's right. The Alzheimer's Association says 5% of people between 65 and 74 have Alzheimer's, and then that grows to 1/3 of people over the age of 85. And the number of people living with Alzheimer's is expected to more than double over the next 40 years.
Joining us now, Urgent Care Medical Director Dr. Bayo Curry-Winchell. Great to see you, Doctor. Walk us through this study. What exactly did they look at, and how long was the study? What did they find?
So they looked at, a large scale of seniors, and they looked at, what were the risk factors, especially of developing dementia, because there's so much that is unknown. And they found that a Mediterranean diet with nuts and vegetables and fish really made a difference. And this is huge because, as I mentioned before, there's so much unknown about this disease. And so to be able to have some information on reducing your risk is huge.
And doctor, explain exactly what a Mediterranean diet is. We're seeing it on our screen right now, but walk us through what some foods are that we should be eating more of and why specifically they're good for us.
So these foods, such as nuts and fish and all of these great vegetables that are available, are high in anti-inflammatory properties. And so why is that important when we talk about dementia? It reduces the inflammation that we see with the disease. So when you consume that, it's a way to reduce your risk through the food that you eat. And as we mentioned earlier, food is medicine, and that could be a way to really help yourself live a healthier lifestyle down the road.
Dr. Winchell Curry, on the opposite side, obviously eating a lot of sugar, processed foods, probably not so good for you. Let's talk a little bit about the fact that there is no cure for Alzheimer's or other forms of dementia. It's something a lot of folks are struggling with, not just the patients themselves, but their caregivers. What are some things that we can do preventatively and also things we might want to avoid so we don't increase our risk?
So there are things that you can do as far as controlling your risk factors. So one thing that I always like to share with my patients, think about doing things that are new, because all of that stimulates the brain. So take a new route home. Don't go your traditional route that you do. If it's exercise, which we know can be helpful, but do a new exercise. Do something that really gets the brain cells kind of charged up. So those are things that we can do every single day to reduce our risk.
All right, Dr. Bayo Curry-Winchell, very good information there that so many people will be happy to hear. Thank you so much.